Well, should you get a coronavirus test if you don't have any symptoms? And do you still have to quarantine after traveling if you test negative? Tonight, Dr. Mallika Marshall answering some of your questions.
So Fernando writes, my wife is in Mexico, and upon returning, there'll be a 14-day quarantine before returning to work. But we're wondering if she goes for testing and is negative, can she return to work sooner? So if she's been exposed to the virus, if she gets a test too early, she could have a false negative. Most people who have been exposed to the virus will develop symptoms around 5 days after exposure, but that can go up to 14 days, hence the 14-day quarantine. Certainly, if she develops symptoms, she should go ahead and get tested. Our next question comes from Patricia, who wants to know if COVID-19 can survive in the ocean and be transmitted to swimmers. So Patricia, I get this question with some frequency, and I think it bears repeating because it is summertime, that you are not going to catch coronavirus by swimming in oceans, lakes, or rivers, but you could become infected if you come into close contact with another swimmer who is infected with the coronavirus. Saul in Waltham writes, I'm 68 and feeling healthy. I've been following social distancing and wearing masks in public. Some of my friends have opted to have free COVID tests performed by some pharmacy chains. Should I get one? So Saul, if you're feeling well and you have no known exposure to the coronavirus, then you don't need to get tested because really it just measures a moment in time. You could be negative today, but then become exposed to the coronavirus tomorrow. So certainly if you find out that you've had contact with someone with coronavirus, or certainly if you've developed symptoms, then it's time to get tested. Our next question comes from Christopher, who asks, when will we know if there will be a COVID-19 baby boom? So Christopher, I'm guessing probably about 9 months from now.
Doctor, thank you so much. Dr. Mallika Marshall, of course, offering her best advice. But as always, consult your doctor before making any decisions about your personal health. If you have a question for Dr. Mallika, 3 ways that you can reach her. Her email is drmallika@cbs.com. You can get her on Twitter. Her handle is @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.